Hello, my name is Doug McCoy. I'm the CEO for Eastern Plumas Healthcare, and I'm joined by Dr. Paul Swanson, who is our medical director for our hospital, our skilled nursing facilities, and is also a longstanding member of our board of directors. And we wanted to talk with the community today about questions that they may have regarding what they're calling the One Big Beautiful Bill, or HR1. It has quite a few impacts on healthcare, and there have been some questions that have come up in the community, and so we thought we would actually put this video together to help try to answer those for some of our community members. And we want you to have the most accurate information possible, and we are very proud to be your healthcare provider, so we're bringing this to you in that way. We put together some questions that we thought possibly might be asked by community members, and so we thought we would work together to try to answer some of those for you. At the conclusion, we want to make sure that if anyone has questions, please feel free to reach out to our administration department, myself included, at any time. Again, we do not expect that this will be completely comprehensive of every question folks may have. And there are a lot of ongoing changes as the federal government works through their budget process. So it's very important that we want to be transparent. So if you do have questions, please feel free to call me directly or any member of our staff. We'll be happy to share those with you. So the first question, I think, is, I keep hearing about the One Big Beautiful Bill and HR1. What exactly is that? And so I think we wanted to share a little bit about that. HR1 is actually not a healthcare bill. It's actually the overall budget resolution bill that's focused on things like border security, tax cuts, infrastructure development, et cetera. But as part of that, it does contain a fairly significant impact to the Medicaid system. And we'll be using Medicaid and Medi-Cal interchangeably. The Medi-Cal system in California is actually a Medicaid program. The federal government uses the title Medicaid. California uses Medi-Cal. So if you hear us use those, they function one and the same. But over the course of the next 10 years, the bill actually reduces the Medicaid spending by the federal government by $1 trillion over a 10-year period. And a lot of that will go directly to healthcare reduction and funding. And so that's why I wanted to make sure that we were sharing the information today.
And I think one of the things that's important to understand is that the finances of small hospitals are fairly complicated and a little counterintuitive. Medicaid doesn't pay 100% on the dollar by quite a long shot. And it, in a kind of convoluted way, makes up the difference by providing what are called intergovernmental transfers to small hospitals. And those are fairly substantial. And EPHC does depend upon those, and those will be reduced in the upcoming years.
And so why that potentially places rural hospitals at risk. For EPHC, about 40% of our revenue annually comes from the Medicaid system, and around 40% of the patients that we serve every day are receiving some type of support from the Medicaid program. So as we look at these cuts over the next 10 years, that will have a fairly significant reduction in the amount of federal funding coming to EPHC. That funding is part of what maintains our services going forward. So for rural hospitals across the country, in 2024, critical access rural hospitals, there were around 432 that were at some type of danger for closing. Rural hospitals have some challenges from the standpoint of the recruitment of staffing for nursing care for providers, et cetera, and costs for services, as Dr. Swanson said. The reimbursement is around 70 cents on every dollar of cost that we provide in terms of our caregiving through both the Medicare and the Medicaid systems. So rural hospitals are always working on very tight margins. So there was a lot of concern in the industry when this went through about what would be the impact to rural hospitals specifically in rural healthcare if the government was then making these types of reductions. So we've been actually focused on this topic since probably January when the conversation came through, and taking a look at, well, what does it mean here locally? What does it mean for you as a community member on access to care? And what will be our plan going forward as we see these cuts and these program changes occur over the next several years? And so I don't know if you want to add anything to that. But.
Sure. I think it's helpful to get some kind of sense for what the magnitude of the cuts is. By the projections that you showed me earlier, this is going to take place, these cuts will take effect essentially over about 4 years until it plateaus. Next year won't be too much, but 4 years out, it will, by the projections, work up to about 10% of net revenue reduction, which is roughly $4 million, so more or less. So that's a significant cut in funding for this hospital, but it's not necessarily catastrophic. And I think one thing that's important to understand is that EPHC is going into this relatively well positioned. We have good cash reserves at this time, and so with work to improve that cut and or to make up that cut in other ways, we should be able to sail through this well. And even in the worst case, it would manifest as us drawing down our revenue, our savings faster than we'd like, but that wouldn't really necessarily produce a serious crunch for a number of years out, even in the worst case.
Well, and one of the reasons that we wanted to get this information out was that prior to the signing of the bill, which was the 4th of July, there was a letter that some group of senators put together that included an attachment that listed facilities across the country, critical access hospitals and other hospitals across the country, and put them into two categories. And one category were those that the cuts could cause an imminent financial risk to, and the other was hospitals that had a very high Medicaid percentage of the patients that they were caring for. The thought being, if you have a high Medicaid percentage and you're reducing Medicaid funding, that places those hospitals in a jeopardized position. EPHC, for some reason, without us being contacted, was placed on that list, and that created some concern within our community. And without access to media resources, there was some concern about what does that mean? Does that keep EPHC in place long term? Will there be changes in the services that EPHC is providing? And so we thought this was a really important time to share the information on why not only do we feel, as Dr. Swanson said, that we're in a good position, but we're actually in a growth mode. We're not in a situation of trying to reduce services. We want to expand those services for our community members. And so we'll talk a little bit more about what that looks like going forward. But one of the questions that we get quite a bit, or that I hear in the media is, well, I'm not on Medicaid, so how does that impact me? And I hear about the Medicaid cuts and what that's going to do. So how does that impact a rural facility and those folks that are on a private insurance or Medicare? And one of the biggest concerns that we always want to avoid is the access to care or the delivery of services. So for a critical access hospital, we've seen, for example, in the Reno area that there have been labor and delivery departments that have actually closed down. And so when you are seeing a funding decrease and a hospital discontinues certain service lines, that impacts everyone, regardless of whether they have Medicaid, Medicare, or any other private insurance. So again, our goal is actually not to decrease services, it's actually to grow services so people don't have to go out of area. But that's why for folks that aren't on Medicaid, this is an important topic for them as well, because it does impact any change to reimbursement has the potential to impact access. And so we're very happy that the position that we're in, that is not something that we foresee happening within our hospital district.
A certain percentage of people who are currently on Medicaid will not qualify, and I think it was something like 10%? 10
to 20%
of those people. And there are a number of aspects to that. One, though, that I do want to mention is which I think is important to know, is that the United States does have a final safety net for everyone, and that is that emergency departments do not turn away any patients. And that's true in all states and all emergency departments. It's part of federal law. And so even for patients in the worst possible circumstance, the emergency department is always open for medical care. That leads, unfortunately, to a situation where you have patients that have difficulty getting ongoing preventative medical care, clinic appointments, and that sort of thing, and they're forced to get care from the emergency department. But at least we have that, and so that's there, and that will always be there.
Yeah, and the federal cuts are specifically impactful for California because California has the largest amount of Medicaid recipients by state in the country. So currently there are approximately 15.3 million people on the Medicaid program, and the HR 1 bill and the reduction, they are anticipating in California a loss of coverage for anywhere between 1.8 million and 3.4 million. So that is a large portion of the Medicaid population. And so the question for government officials, healthcare providers, et cetera, is how do we continue to ensure, to Dr. Swanson's point, that people still continue to receive preventative care, emergency services, et cetera, and also help. There have been changes in the eligibility qualifications as well. And so under the old program, patients would have to do re-eligibility on an annual basis. That now is changing to needing to be done every 6 months, which presents some challenges for folks, especially our senior population, to make sure that all of that information is gathered and submitted within that 6-month timeline so that people don't then lose coverage for the next year. So there are a lot of process issues within the program that are going to change as well, eligibility requirements, et cetera. And we want to make sure that our community members are well informed and supported so that they can make sure to maintain their eligibility going forward. So we don't see people that are losing coverage in our area, but it looks to be very significant for the state of California. And so we know legislators in Sacramento are working on that right now in terms of how to address that, not only this budget year, but in future budget years.
And as we had mentioned when we were talking earlier, that EPHC is available to help people with Medicare, or Medicaid rather, applications. And that's so even for patients who aren't immediately receiving care here.
Yeah, we have been doing and will continue to do some community events in collaboration with Plumas Bank and the Porter Simon Law Firm on eligibility issues, Q&A on how do you access Medicare benefits, how do you access Medicaid benefits, how do I work through my insurance. And we have a wonderful financial eligibility department here run by April Shepard that meets with any community member, whether they are an active patient or not, to help them walk through that process. In addition, we launched our CalAIM program, and this has been, I think, going on 2 years now. We're serving about 125 community members who are on the Medicaid system to help them navigate through whether it's eligibility and application filing, whether it's for additional resources related to housing, et cetera. And so that's an additional way that EPHC is trying to help our Medicaid participants in our area maintain coverage and access to care and services going forward. And we're very happy that that program, again, will be continuing. So one of the questions would be, is there a potential with all of this for EPHC to cut services? And as I said, we are actually looking to grow services instead of reduce them. We are excited that we'll be launching the Senior Life Solutions Outpatient Geriatric Mental Health Program here actually towards the end of this year. We are very excited that we are expanding our rehabilitation department, our outpatient rehabilitation department, into a new building, and that we hopefully will have construction finished towards the end of this year. We are going to be significantly growing our CalAIM program so that we have a larger footprint in the Portola area for that. We've just added on additional services such as vestibular rehab, Dr. Swanson led the add of cardiac monitoring system in the ED. We are reestablishing our mobile MRI program, and we are continuing on with our endoscopy program through a new GI physician.
Yes. So. And one of the things that I think is important to mention is that we are here. There are some patients who are getting care in Reno, and there may be various reasons, but I think one of the biggest reasons is that people don't know we're here, or they haven't had much contact with us. And we are here. We provide clinic services. We have inpatient hospitalization. And one thing I'd particularly like to point out is there's a particular service that we provide, which is called swing admissions. And what that is if someone has been hospitalized for an acute medical problem and has been treated for that, but is too weak to go home and needs physical therapy and strengthening, they can be kept as a patient in the hospital in a particular status, which is called swing. And we provide that service. And that service is available even for patients that have been treated at a hospital in Reno and have completed their medical treatment there. They can come to our hospital. And one of the things that's really routinely said is that the swing patients really rave about the amount of attention they get and how good the care is and how much personal attention they get from nursing and other staff. And we can do that because our volumes are low, and we really do have a culture that provides that very readily. So that is always a possibility. If you or someone you know is hospitalized in Reno and gets to the point where you are in need of rehabilitation or strengthening, you can request to come back to Eastern Plumas Hospital. That's your right to request it. And it can be closer to home, and you can get very nice personalized attention here.
So we talked, one of the questions that we thought would come up was, again, what is the EPHC's, if this is a 10-year reduction in Medicaid, what is EPHC's long-term plan? I talked a little bit about the growth that we were looking to do. 4.5 years ago, we really focused intently on patient experience. Hopefully, many of you have received or been requested to provide a patient experience feedback form. So we made a focus on patient experience and also our employee enrichment. And that has been a foundational piece of our organization for the last 4.5, 5 years. One of the areas that we can help mitigate some of these reductions is to continue to provide high quality care and be reimbursed based on incentive payments that are designed based on quality metrics. And so we will continue to be focused on requesting community feedback on your experience, outcomes, etc., because that high quality level is linked to availability of additional funding that can help close some of the gap that we will have from the federal Medicaid cuts that are coming forward. We have, over the course of the last 3.5 years, worked to get grant funding to the tune of about $7 million to help us with projects such as the Loyalty Medical Clinic, the upcoming expansion for our CalAIM program. Our EPHC Auxiliary has been wonderful at funding some of our large equipment projects on an annual basis. So we will continue to focus our efforts on different grant programs that continue to be available as we go forward. Again, as I said, we are looking to continue to grow some of our services, so we're excited about that. But one question that we get a lot, and Dr. Swanson spoke to it a bit, is, as a community member, what can I do to help? And as we said, although our area is sort of the best kept secret in the Sierras, we do not want to be as a hospital. We are very proud of our 300 staff members here, great quality people, very committed to the community. And so we want to try to provide every service that we have available to our members here so that you don't have to go out of area. And so If you have had a great experience, please share that with friends, neighbors, etc. If you haven't tried out our services, give us an opportunity, because we're here to provide, again, a high quality experience. And that is really the focus of our mission and values within the organization. So that would be, if you're looking to what can I do, just reinvest in your hospital by utilizing us and letting us share our quality of care and service with you.
And on the issue of quality of care, I just want to make sure everyone knows that the emergency department has 8 physicians. They're all highly experienced. All of them have had extensive experience at large medical facilities. And it's really a strong group. We have a really highly experienced group of emergency physicians who are all wonderful people. And I'm very happy with what we have to offer there. As an emergency department in a small hospital, there is need for transfer on occasion of patients that require care that we don't have available to us at this hospital, specialty care, intensive care. But we do have that available. We routinely transfer patients by ambulances and helicopter, and that process is very well oiled and very smooth. So I can safely say that you get very good care at our emergency department. Also, I'll mention the waits at the large hospitals in big cities like Reno often can run several hours or many hours. And typically in our little hospital here, it's rare to have a wait for more than an hour. Most of the time, patients are brought right back and seen promptly. So I think we have a great emergency department. As far as inpatient care, the same doctors in the emergency department do take care of patients in the hospital. And we've been doing that as a program for about 10 years. It's worked out very well, and I'm very happy with that program. And then on the clinic side, we have 6 primary care physicians, 4 mid-levels, if I have the numbers right, and then a variety of specialty care services, including orthopedics, cardiology. Help me with the rest of them.
Orthopedics, cardiology, OBGYN services, pediatry, dental.
Dental, we have an
dental clinic.
We have a gastroenterologist who comes in monthly to do colonoscopies,
as well as some telehealth services.
Yes,
that are available.
Yeah.
And 3 more providers that are going to be joining our group here in the next 2 months.
Okay.
So excited about that, along with behavioral health. So
good. I think we have a very good hospital here. Going back over decades, there have been various changes in administration and so forth, but I can really safely say that Eastern Plumas Healthcare is at a high point now, and things have been very steady and very smooth for quite a few years, actually the entirety of the time you've been here, I think. And so I think we are really at the top of our game at this point in time.
So we appreciate you taking the time out. Please feel free to share this link. As I said, reach out to us at any time. Our board, our leadership team is transparent. We're here to serve our community. And although this is probably the most significant change the healthcare industry has faced in the last 50 years, we feel very confident that we have not only the expertise, the leadership, the governance, but also the infrastructure to make sure that we are well maintained going forward and able to, as I said, grow services and be your provider of choice. So thank you very much.
Thank you.